Advanced stage of Parkinson's disease, or APD as we call it, is actually it's quite a gray area still, although there have been many attempts at developing criterias that can allow clinicians, experts and non-experts, to decide, well, somebody has reached the advanced stage of Parkinson's. Broadly, if we think about it in a clinical context, it's the time when all the traditional oral conventional therapies are not really working. In other words, the patient's getting off periods in spite of them, or maybe dyskinesias, or maybe just generally feeling worse. And you've tried the transdermal option that's also available to us, and maybe that is not either being tolerated or is causing problems. Well, that is a situation where further intervention with oral therapies make little difference. Because what happens in Parkinson at this stage is you also get a lot of gastric issues. In other words, absorption from the stomach is also considerably delayed due to various factors. So in this is the situation where we would think somebody's reached the advanced stage because it needs device-aided therapy. Now, it could be assessed by a criteria, the so-called 5-2-1 criteria, which is 5 doses of levodopa, 2 hours of off per day, 1 hour of troublesome dyskinesia, along with other features like, dysphagia, some non-motor issues like sleep problems, some functional problems like difficulty with mobility, falls, etc. Or you can have part of the criteria derived from this is the managed PD criteria. So, you can use all of that, but I think clinical judgment remains the most important thing because there is no fixed period when somebody reaches advanced Parkinson. It's very variable. It's a very sort of variable concept. And again, the concept may be a bit different between those with so-called early onset Parkinson's, so younger people with Parkinson's, versus those with late onset Parkinson's. So you can see they're and so it's quite a difficult thing to diagnose in many ways.